My name is Dr. Kevin Mercado. I'm a chiropractic doctor. I also run a sports medicine program at Monrovia High School, and I'm an adjunct instructor for Pasadena City College. This video is designed for the student and assisting them in helping learn a bit more easier or more easily the muscles, origins, insertions, and actions of the anterior thigh group, which is the quadricep group, and the posterior thigh group, which is the hamstring. So first off, I've decided to use stretchy tape to mimic the muscles. I've decided to just identify the rectus femoris as the one muscle that we're going to discuss. That muscle is crosses two joints of the quadricep group. So I like that muscle because it's very easily identified in terms of the origin. And then obviously insertion is very similar with the other muscles. But the rectus femoris will be that muscle that we'll identify with. And then the biceps femoris long head and the biceps femoris short head is going to be both muscles that I will identify with regards to the hamstring group. So to get started, the quadricep is a very, very strong, powerful muscle of the anterior thigh. The rectus femoris is a muscle that originates on the anterior inferior iliac spine of the pelvis, and then it inserts onto the tibial tuberosity, which is indicated in black here on the screen. So black anterior inferior iliac spine, black here as well, internal or tibial tuberosity. I've also used this model here to my left to indicate what those look like from an anterior perspective, because what you're getting here is a lateral view, so it's a bit more easy to see with two viewpoints. So again, the anterior inferior iliac spine is a muscle that or is an origin of the rectus femoris. It transitions all the way down onto crosses the joint and attaches onto the tibial tuberosity of the tibia. So again, this model here is a smaller model. I'll show you. I've also identified the anterior inferior iliac spine here, which is the origin of the rectus femoris. And then obviously this is the muscle that transitions down. And then from there, it will transition down. It will transition down to the tibial tuberosity of the tibia. The rectus femoris is a strong, powerful muscle. When it contracts, it has a very strong capability of performing actions at two joints. It performs the action of flexion of the hip, right, which is here, and also has the action of extension of the knee, which is there. So it can extend the knee and then obviously flex the hip. So it has the capabilities of performing two actions, sometimes simultaneously, other times not. The contraction, and with the stretchy tape, what I'll show you is that when we have a contraction of a muscle, it contracts very similar to this. Okay, so 2 points or one muscle fiber will contract from one end here to another end here. So one muscle fiber, it will contract together. And not only does it contract at one point, it contracts like this across the entire muscle all at the same time. Okay, so we'll have multiple contractions down along the muscle all at the same time. And there's not just 4 or 5 muscle fibers in one quadricep group or one muscle group, there's millions. So when you get millions of muscle fibers contracting all at once, you'll begin to get movement of the particular bones and the joints that those bones create. So if I were to contract a few, we'll do this for demonstration purposes all at once, we begin to start to see the knee begin to extend. Okay, so you can see this knee, it's a bit toward the lateral portion of your screen, but you can see if we can slide this over just a little bit so you can see it a little bit better. We'll begin to get the knee to extend rather than flex. So you get this extension of the knee, and then as you get more extension and more contraction, you'll begin to get flexion of the hip. Okay, so you get this extension of the knee and flexion of the hip with a powerful contraction like the quadricep and the rectus femoris can provide. Now, the rectus femoris and the vastus lateralis and the vastus medialis, those muscles, they will all contract and sync together to create one powerful motion. Now, as this muscle contracts and flexes the hip and extends the knee, or even if it just, let's just start with flexing the hip, the hamstring group, which the hamstring, again, the biceps femoris muscles are both here, the long head and the short head. The long head is indicated by obviously a longer muscle, and the short head is indicated in black with a much shorter muscle. As this quadricep contracts this and extends the knee, you'll begin to see the muscles of the hamstring lengthen and stretch out. So there is a absolute correlation and relationship between the quadricep and the hamstring group. The quadricep has to, when it contracts and it performs its extension of the knee, the hamstring group must stretch in order to allow this quadricep to perform the action it needs to perform of extension of the knee. The quadricep, as it extends the knee, and you can see here, it's pretty slack here with regards to this particular motion. Okay, so again, for video demonstration purposes, we'll get with flexion of the knee and, flexion of the hip and flexion of the knee, or flexion of the hip and extension of the knee, we will get the quadricep will not be taut or tight. Okay, it will be in a contracted phase, but it won't have to be stretched out like the hamstring. So the quadricep, this is for this, the purpose of the video, we're just going to look at how much slack there is from the, and even space there is from the quadricep here and the bone which it correlates to. So there's quite a bit of space in between the quadricep group, the rectus femoris, and the femur. Now, that's not necessarily how it works, obviously, in anatomy. There's a lot of soft tissue and fascia and all of that that connects a lot of the muscles together and attaches it to the different bones that it surrounds. But for the video demonstration purposes, I want to just show you that it's much more slacked, okay? So it doesn't have a stretch to it. It's contracted, not stretched. If we were to flex the knee, okay, you'll begin to see now the quadricep is a bit more taut compared to where it was with a extended knee. So the flexed knee creates some stretch and some tautness in that muscle. Now, the hamstring is beginning to work with the flexed knee, which means that the quadricep now has to go on a stretch. In this position, it's not on a full stretch because the hip has to be in extension and the knee must be in flexion in order for the quadricep to be on a full stretch. So currently right now, it's on a partial stretch. But for the demonstration purposes, we'll show that the quadricep is much more loose now, or slacked. It's not taut anymore, it's not tight. And then now you'll see the space between the muscle and the bone begin to close as the knee flexes and the hamstring does its work to flex the knee. The quadricep must elongate or stretch in order for that to happen. So now you'll see that the space between the quadricep here and the femur, let's move this out of the way just a little bit, and the femur is much, much closer together. So with regards to the quadricep, it is a very strong, in summary, it's a very strong hip flexor, and it's a very strong extensor of the knee. Now, if we go to the hamstring is a little different in that the hamstring has an origin. Now, if we flip this around, the hamstring has an origin, okay, of the ischial tuberosity, and it transitions down on the posterior side of the leg and inserts onto the multiple areas. So it inserts onto the lateral portion of the tibia, posterolateral portion of the tibia, and on the fibular head. It also has other muscles that transition down the medial side, semitendinosus and semimembranosus, which attaches and has insertion points and attachments to the pes anserine of the medial surface of the tibia, and then the medial aspect, the tibia, posterol medial tibial area, just for generalization of that. Okay, so it does transition all the way down, attaches to the posterolateral portion of the tibia and the fibula, so it also does cross two joints. So on this model, we'll look at the ischial tuberosity, which is right here. The ischial tuberosity obviously is on the ischium, the posteral inferior portion of the pelvis, and then it transitions down. And for the sake and purpose of the video, obviously I mentioned we're going to talk about the short head of the biceps femoris and then the long head. The semitendinosus, semimembranosus on the medial aspect, so it'll be a little bit more difficult to see on this for this demonstration purposes. So we're just using the lateral portion, lateral muscles of the hamstring group to articulate the study and the messages for this video. So as we mentioned before, that the hamstring in general, it is on a full stretch. So with hip flexion, it has a bit of a stretch with hip flexion, but really has a stretch with knee extension. Okay, so the hamstring in itself, we'll rotate this a little bit so you can see. The hamstring in itself has an action of hip extension and knee flexion. So it will bring this, if let's just say the table wasn't here, or we flip the skeleton on its stomach, then we could get this is like neutral. We could actually perform the movement of full hip extension and knee flexion in order to show you what that looks like. But for the purposes of this, we can show you going into neutral hip and then a slight flexion. So just understand that if I were to pull, okay, so let's slide it back just a little bit so you can see. I can show you how the hamstrings will pull into flexion. So again, the same principles apply when we did this contraction aspect of the video. The same concepts apply to the hamstring. So the hamstrings contract, they're going to flex the knee. Now, they will also extend the hip, and again, they're a very, very powerful hip extensor and knee flexor. So with that being said, what I've done is I've identified the hamstring long head, and I've drawn some purple marker on some tape to identify the long head, and I've drawn some black tape to identify the short head. Now from the video, it looks like the insertion point is not on, actually on where it should be on the fibula. But it actually is, it is where it should be. It just doesn't look like it because it's pulled off a little bit. So with the tape, so it's pretty close. And it works out really good to show you the stretch, even if it was a little bit off on its exact insertion point. So it's not necessarily attached to the tibia here. I've attached it to the fibula in order for you to, the fibular portion of its insertion, in order for you to see it a little bit more clearly, because the tibia would be a bit more difficult on this. So when we contract the quadricep to extend, so we're contracting, extending the knee, you can begin to see again the stretch and elongation of this muscle, both bicep and, or both long head and short head. So the long head you can see elongates, and the short head also elongates. Again, you can see there's quite a bit of slack in this muscle with knee flexion, and even this muscle here with the short head with knee flexion. And as it moves into knee extension, you can definitely visualize what this tautness looks like. It's much more taut here on both, and actually the space in between the long head and the femur, or the short head and the femur, and the long head and the femur, it actually gets much closer together as it gets more taut, compared to when it begins to get more slacked. Okay, so I can pull this out quite a bit compared to what I could do from when it's in the extension. Same thing with the long head. So there's quite a bit more movement that occurs. So when we get to extension, it's much more difficult, and I'm pushing about the same. It's much more difficult to get it out into where it needed to be, or where it was with knee flexion. So what I've done also is I've colored these muscles. And so we're going to do a little quick measurement. So I get my measurement tool, show you how it elongates as it stretches. So right now I have it at 0. The top of the purple is 0. And the ischial tuberosity is at 12. So it's 12 inches in knee flexion. As I extend to full knee extension, it's now 2.5 at the top of the purple. So it's now 2.5 here. And then down here so that's the insertion. At the origin, it's about 18.5. Okay, so it went from 18.5. So 18.5 minus 2.5 is 16. So it went from 16 inches, it went from 12 inches here to now 16 here, which is a difference of 16 minus 12 is 4 inches difference in length. So it went from 4 inches less to now 4 inches more with the long head. Now, if we did the short head, and then one other thing about the purple before I move into the short head, you can see, let's see, the short head is the blue, the top of the purple is right about, the bottom of the blue is right about at my shoulder. Okay, so right there. So as I extend it, now the bottom of the purple is well above my shoulder. Okay, so you can definitely tell from here, this demonstration, that the muscle is absolutely elongating. Let's go with the short head. The short head is no different, right? So the short head, and here with the short head, we're gonna just do the insertion point at the bone to its origin where the red is. So that's about 8 inches in knee flexion. So I go extend it. And now it's full extension. And now it is about 11. Okay, so let's go here. It's about 11. So 8 to 11. So it's a 3-inch difference from knee flexion to knee extension. So again, it absolutely elongates with regards to fully extending the knee. So the muscles of the hamstring must stretch and be able to elongate in order to help or allow the quadricep to perform its function. The same thing with the flexion of the knee. As we flex the knee and extend the hip, if we were to extend the hip, the quadricep must absolutely be able to stretch on command in order to allow the hamstring to do its work. I hope this video has been effective and helpful for assisting your learning process. Thank you very much. Take care.